Hi, my name is Julian Hong. I graduated from the Duke Radiation Oncology Residency Program in 2019. I am now a faculty member at UCSF in Radiation Oncology and Computational Health Sciences. Clinically, I specialize in the treatment of GU malignancies, and my research program focuses on the development and deployment of computational tools to improve patient care. The scholarly year at Duke during residency was really instrumental for me to build what is now my current research program. It was a really unique opportunity to just interface with folks across the Duke campus. For me, that was mostly an opportunity to work with computationally minded folks, and in particular spent a lot of time working in the research group of a faculty member in the Department of Biostatistics and Bioinformatics. She was a great mentor and is still an important mentor that I have today. Most of my time during my scholarly year was oriented towards building a machine learning tool using data from the electronic health record at Duke. The tool was oriented towards predicting whether or not patients would have acute care requirements during their radiation treatments. And it was a nice bridge, the computational departments at Duke with our department in radiation oncology, and sort of bring those two worlds together, which was really neat. I think one of the most amazing pieces of that collaboration was really sort of our opportunity to work together to the next step. The stuff that we did during my research year ended up forming the platform for which we ended up building a randomized study on. And that study ended up being one of the first published randomized studies investigating the clinical benefit of using machine learning or artificial intelligence in a clinical setting. The scholarly year was really important. Gave me a chance to build a number of computational approaches that I'm still using today, which include machine learning approaches and natural language processing. And all of those elements are really important in the work that I do now research-wise. The scholarly year was really just a nice opportunity to have continuous work in my area of research interest, and really played a major role in informing what I do now.
My name is Yvonne Mowery. I'm currently the Butler Harris Assistant Professor of Radiation Oncology at Duke University. I completed our Radiation Oncology residency program in 2017, and I was fortunate to be in one of the first classes that had a full year of scholarly activity during residency. This year that I spent in the laboratory of David Kirsch was absolutely revolutionary for my career. It started me on a completely different trajectory to becoming a physician scientist with my own laboratory. During that year, I spent time with mouse models of soft tissue sarcoma, testing the combination of radiation therapy and anti-PD-1 therapy that led to a currently ongoing phase 2 clinical trial. Based on this fantastic experience that I had during my 4th year of residency in the Kirsch laboratory, I decided to become a physician scientist with my own laboratory focused on using primary mouse models of both sarcoma and head and neck cancer to study radiation in combination with other therapeutic agents, as well as to study normal tissue toxicity. I truly can say that my career has gone in a totally different direction than it would have if I had not had this fantastic opportunity for 1 year of scholarly activity during my PGY4 time in residency.
My name is Andrew Martella. I'm one of the Duke Radiation Oncology residents who graduated in the year 2019. I wanted to just give a short explanation of my scholarly project and how it dramatically impacted where I am today. When I was at Duke, I had a strong interest in hospital administration, and I expressed this to the department and also sought out some advice from the president of Duke Hospital at the time, who was Kevin Sowers. They had offered a hospital administration fellowship that was mostly designed for MBA students and other non-hospital individuals who are interested in administration. They offered a truncated program to me, so instead of 2 years, a 1-year program, since I already had a lot of experience being in the hospital setting throughout residency and medical school. And the chair, Dr. Willett, Dr. Slama, Dr. Lee, everyone was incredibly supportive in allowing me to seek this opportunity and take advantage of it. So for a year, I was part of the Hospital Administration Fellowship. Each month, I rotated through the hospital with different leadership. I spent a few months side by side with the president of Duke Hospital, had some remarkable experiences, traveled to DC to lobby for 340B, was able to be involved in numerous hospital improvement projects, and also some very difficult conversations, and I was able to see how to approach things from different angles, which was very eye-opening coming from the health provider perspective. I was able to rotate with the CMO, the CFO. I helped put together business plans for new constructions on the hospital campus, and also worked on a project that looked at hospital length of stay and how that impacted the finances. So I came into this without having a business background or an MBA, and it gave me a lot of tools and things to talk about on the interview trail. And so when I went to find my job outside of residency, I expressed my strong interest in hospital administration and leadership settings, and I eventually applied to Stanford, where they had a position that blended clinical medicine and also working in the hospital administration sort of setting in the network of the Stanford Hospital Cancer Center. So I currently work in the East Bay at a satellite for Stanford, and I'm slowly making my way into different hospital administration positions, leadership boot camps. It's been instrumental in helping develop my career. I'm incredibly grateful for the opportunity and the support that the department gave me in doing something that was a bit not your typical scholarly project, but it's been incredibly beneficial to me.
Hi, my name is Fumiko Chino. I'm a physician at Memorial Sloan Kettering Cancer Center, and I graduated from the Duke Radiation Oncology residency program in 2019. I have been overjoyed with the experiences that I've had at Duke during my residency and specifically during my research year. I felt I was able to have really strong mentorship and also a real diversity of projects, and then full support within the department to complete those projects in both a timely fashion, but also with all of the additional resources that they may or may not require. I do feel that my research productivity at Duke was one of the main strengths in my application when I ultimately did seek a faculty appointment, and I feel very confident that it's what got me here today. So I could not speak more highly of the Duke program, and I really feel like you're going to have a great experience. And of course, if you do have questions about Duke, I'm also actually happy to answer them if you want to reach out to me directly, because I could not be a bigger cheerleader of the Duke Radiation Oncology program.
My name's Adam Olson. I'm a radiation oncologist at UPMC Hillman Cancer Center in the University of Pittsburgh. During my time at Duke, I participated in a number of clinical research projects, kind of spanning a wide range of topics, including the use of radiation and immunotherapy for metastatic melanoma, which resulted in multiple publications, kind of the optimal use of stereotactic radiosurgery for brain metastases that also was combined in some cases with immunotherapeutic agents. In addition, and was really kind of formed kind of the heart of my scholarly project, was enrollment in a Duke Masters of Science in Global Health. I've been long interested in looking at healthcare disparities, both domestically and internationally, in oncology and radiation oncology specifically. Duke had a integrated program that offered a master's level training in biostatistics, as well as global health principles and other MPH-like course offerings that resulted in an advanced degree. And then in conjunction with that, I spent several months in Tanzania, which is in East Africa, where a center there had been marked as a priority site for global health outreach in oncology. They were in the midst of installing a radiation device, and so I was fortunate enough to be on the ground when they first started treating patients at that facility. That was essentially broken up into two parts. So the first part of my master's program was mostly the course didactics during my PGY4 year. And then I spent several months after I concluded residency as a PGY, 5.5, to complete my field work. And then that led to a master's thesis and a successful defense approximately a year after I concluded residency. Those efforts have directly led to opportunities that I'm developing here at the University of Pittsburgh. I've actually developed a close collaboration with a medical oncologist that Dr. Salama knows well, who was at the University of Chicago and is now here looking at combining radiation and immunotherapy for patients with advanced solid tumors in a rational fashion. A lot of what I am doing now can be directly tied back to what I got started with at Duke, and I have nothing but wonderful things to say about the training milieu and the opportunities that await you at that institution.